Hi, I'm Melody Nailon and I'm going to present to you poliomyelitis. What is poliomyelitis? Poliomyelitis or polio is an acute viral disease caused by the polio virus. This has three stereotypes, from 1 to 3, with type 1 being the most likely to cause paralysis. The infection is highly contagious, spreading mainly through the fecal-oral route and less often through contaminated food, water, or respiratory droplets. While most infections are silent or cause only mild illnesses, a small fraction progress of poliovirus could lead to acute flaccid paralysis, which can result in lifelong disability or even death if breathing muscles are affected by the virus. Polio primarily affects children under 5 years old, but any unvaccinated person are still at risk of getting polio virus. Since there are no cure, treatment is supported, and survivors may experience long-term complications such as post-polio syndrome, marked by new muscle weakness and fatigue decades later in their lives. Globally, vaccination has been the most powerful tool against polio, causing cases to drop by more than 99% since the year 1988. While poliovirus type 2 and 3 have been eradicated, type 1 remains an endemic in countries like Pakistan and Afghanistan, and vaccine-derived strains continue to cause outbreaks. Thus, while eradication is close, immunization and surveillance remain essential up until today.
Poliomyelitis typically begins when a person, most often a child, ingests poliovirus via fecal-oral route or less frequently through respiratory secretions, according to Wilbur 2024. The virus then attaches to the host epithelial and immune cells by binding to the CD155 receptor or the poliovirus receptor, enabling entry and infection. According to CDC 2024, once inside, the virus replicates within the oropharyngeal and intestinal mucosa, then spreads to regional lymphoid tissues, leading to primary viremia. In most cases, the infection remains abortive or causes only minor self-limited symptoms like fever, sore throat, malaise, headache, vomiting, and abdominal discomfort. CDC 2024. These symptoms often leads to loss of appetite and subsequent weight loss, and if prolonged may lead to chronic malnutrition, according to Bupatiraju 2023. From there, the virus may disseminate through the reticuloendothelial system, multiplying further and resulting in a secondary, more substantial viremia, according to Mesegar 2025. However, in a small minority of viremic cases, the virus enters the central nervous system by crossing the blood-brain barrier or via peripheral nerve retrograde axonal transport. Depending on the virus type and location of invasion, CNS invasion causes two things, the paralytic and non-paralytic. Non-paralytic or aseptic meningitis poliomyelitis occurs when the virus induces inflammation of the meninges but without motor neuron destruction. Paralytic poliomyelitis results from direct infection and destruction of alpha motor neurons in the spinal cord and/or brainstem, sometimes exacerbated by inflammation, according to Mesegar 2024. Paralytic forms can be further subdivided as follows: the spinal polio, bulbar polio, and bulbospinal polio. So the spinal polio is characterized by asymmetric paralysis that most often involves the legs. Bulbar polio presents with weakness of facial or pharyngeal and respiratory muscles innervated by cranial nerves, which results to dysphagia, difficulty breathing, and facial muscle weakness. And bulbospinal polio is a combination of bulbar and spinal paralysis, which results to a widespread flaccid paralysis. In the non-paralytic type of poliopath, flu-like symptoms can be felt same in abortive polio but more severe. Symptoms like severe headache, flu-like symptoms, pains in arms and legs, extreme sensitivity to touch, and this also results in loss of appetite, and reduced mobility. Poliomyelitis infection affects nutrition in several ways. First is symptoms like fever, sore throat, and trouble swallowing, reduced appetite, making it hard for patients to eat enough nutrients needed for immune system support and healing. At the same time, the body works harder to fight infection, which raises metabolism and energy needs. The need for vitamins and minerals like vitamin A, D, C, zinc, iron, and selenium is higher because the immune system is more active and oxidative stress is greater, according to Metagenics 2020. During infection, the body mostly favors protein breakdown than fat, using the body's protein and energy stores. Without enough food intake, this causes weight loss and muscle breakdown. Paralysis from nerve damage causes muscles to be unused, leading to muscle wasting and loss. Immobility and inflammation add to this muscle loss, worsening strength, according to Polioplace 2025. Over time, continuous low food intake and higher metabolism cause chronic malnutrition, making recovery slower. Malnutrition weakens the immune system, increasing the risk of further infections and delaying healing, according to Morales et al. 2023. The symptoms of poliomyelitis differ significantly based on the stage of the infection, ranging from a mild flu-like illness to life-threatening paralysis. Most poliovirus infections, about 95%, are asymptomatic, meaning they do not cause any symptoms. So there are three stages of poliomyelitis, and the first one is the abortive poliomyelitis or so-called mild illness. This is the most common symptomatic form of polio, affecting about 5% of those infected. It involves no central nervous system invasion and typically results in a complete recovery within a week. Symptoms include fever, sore throat, headache, headache, loss of appetite, nausea and vomiting, stomach ache or abdominal pain, and general feeling of illness or malaise. The next one is the non-paralytic poliomyelitis. This form affects about 1% of infected individuals and involves the central nervous system, causing aseptic meningitis without paralysis. Symptoms include initial flu-like symptoms similar to abortive polio, more severe headache, stiff neck and back, pain or stiffness in the arms and legs, extreme sensitivity to touch, muscle tenderness and spasms, pins and needles sensations, or paresthesia. Lastly is the paralytic poliomyelitis. This is the rarest and most serious form of the disease, and it begins much like the non-paralytic type but progresses to severe symptoms. It develops in less than 1% of all polio infections. So paralytic polio is classified into three types depending on the level of involvement. So these are the spinal polio, the bulbar polio, and the bulbospinal polio. So the spinal polio is most common, accounted 79% of paralytic cases. It is characterized by asymmetric paralysis that most often involves the legs. Bulbar polio presents with weakness of facial, oropharyngeal, and respiratory muscles innervated by cranial nerves and accounted for 2% of cases during this period. Bulbospinal polio, a combination of bulbar and spinal paralysis, accounted for 19% of cases, and symptoms include intense pain, loss of muscle reflexes, severe muscle aches and spasms, floppy limbs or flaccid paralysis, loss of control over the bladder or urinary retention, and difficulty breathing, speaking, or swallowing if the cranial nerves are affected.
In the dietary management of poliomyelitis, nutrition support is vital for recovery to prevent complications. Since it's known to have no specific antiviral cure, we focus on symptom-based nutrition care, and this management varies by the type, whether it is abortive, non-paralytic, or paralytic poliomyelitis. So first, let's talk about the abortive poliomyelitis. Given that these are its symptoms, our nutritional goals should be to reduce gastric irritation, prevent dehydration, and maintain adequate energy intake. Thus, the dietary recommendations are this. First is soft, bland diet, like soft fruits, soups, or even our lugaw to aid on the throat irritation and nausea. Next is small, frequent meals to prevent worsening the gastrointestinal symptoms like vomiting. Next is increased fluid intake like oral rehydration solutions, clear broths, coconut water to address dehydration due to vomiting. And high energy, nutrient dense foods to support immune response for full recovery since we rely on our immune system. So next is the non-paralytic poliomyelitis. So if these are our symptoms, the nutritional goal should be to relieve discomfort, maintain hydration, and support neuromuscular function since the virus is already in our meninges. And the dietary recommendations are balanced diet with adequate protein like fish, lean meats, legumes for immune function and muscular repair since there's already a damage on the tissue in our meninges. Next is magnesium and potassium-rich foods, which are your banana, leafy greens, your sweet potatoes to reduce muscle cramps and spasms, and anti-inflammatory foods like fruits, vegetables, and omega-3 sources such as your fish and nuts because there's already an inflammation in the body. Next is adequate hydration to alleviate the headache and muscle tension. So we only focus on helping the patient be more comfortable. So the last one is the paralytic poliomyelitis. So if these are the symptoms, our nutritional goal should be to ensure safe swallowing, preserve muscle mass, prevent constipation, and maintain overall nutritional adequacy. So in this, we have to be very careful because the virus is already damaging the motor cells. Thus, the dietary recommendations for this are if the patient has spinal limb paralysis, which means that they may have difficulty in feeding themselves, they recommended is they should have a modified food textures and use of assistive feeding devices with high protein diet to maintain muscle strength. For the bulbar poliomyelitis, they might have swallowing and respiration difficulties. So we recommend a tube feeding with when dysphagia is severe, thickened liquids to prevent aspiration, that we have to be very careful to prevent aspiration, and soft, frequent meals to reduce swallowing difficulties since the patient has already had difficulty in swallowing, so we should provide an easy to digest or easy to eat food. Next is the bulbospinal poliomyelitis. In this, we recommend an enteral nutrition often required strict aspiration precautions with the use of balanced, energy-dense enteral formulas. And that's all for the dietary management of poliomyelitis.